Today I'm going to delve into a few of the most popular myths involving physiotherapy. Unfortunately, many people still see physiotherapy as an alternate treatment, and as such, there are many misguided beliefs and myths. Sometimes a physiotherapist is the last port of call, a last-ditch effort at solving a problem, when in fact it should be the first stop for the particular problem. As a physiotherapist, over the years, I've seen clients who have spent thousands of dollars with surgeries and medications to end up only masking the pain. While managing and minimizing pain is important, it's only a short-term solution. The long-term solution is to identify the trigger of the pain and treat that trigger to completely eliminate the pain. This is what physiotherapists are best at. So let's take a look at some of the most common physiotherapy myths. The first myth is that physiotherapy is considered an art and is not backed up by science. This is quite obviously false. There are several thousand scientific papers and research studies supporting the use of physiotherapy in a number of health situations. Physiotherapy is the highest evidence-based health profession, meaning much of what we deliver has been proven to work in research settings. Elite athletes and sporting teams consider physiotherapists as an integral part of their medical team, and so should you. The second myth is that a physiotherapist will see you for a few minutes and then strap weird machines on you for the rest of your visit. Again, this is wrong. In every industry, there are good and bad eggs. Unfortunately, these bad eggs create an incorrect view or perception of what physiotherapy is about. In my practices, we do a minimum of 30-minute appointments so that we can really do in-depth analysis and diagnosis with our clients. While there will be some hands-on aspects of your treatment, and this could possibly include some advanced physiotechnology, this portion of your appointment should be at least after about 15 minutes of diagnosis-based conversation. Every session is a minimum of 30 minutes so that we can actually address the underlying causes of your pain or injury and not just provide simple symptom relief where the underlying problem continues to flare up those symptoms time and time again. The third myth is that a physiotherapist only treats acute injuries or elite athletes. The truth is that physiotherapists treat a wide range of injuries, ranging from acute injuries to chronic injuries, as well as sporting injuries with elite athletes. With chronic injuries, there is usually baggage like poor postural habits, muscle imbalances, misguided beliefs related to the problem. These are all things that physiotherapists treat every single day. The fourth myth is that physiotherapists only treat muscle, ligament, or tendon related problems. This again is a misguided belief based on assumptions that are just not true. Not only are physiotherapists the top experts in diagnosing and treating all musculoskeletal pathologies in any area of the body, some also follow advanced courses in vestibular rehabilitation, mental imagery for chronic pain, pelvic floor rehab for urinary incontinence, to just name a few of the other specialty areas. The fifth and final myth we'll cover in this physio podcast is that you need to invest significant time, money, and effort with a physiotherapist to get results. The truth is that as when your problem is fixed, you will often stop seeing a physiotherapist for that reactive type treatment. But hopefully, what will be offered is a different wellness pathway or different wellness pathways to enhance the quality of your life with an abundance of great health and happiness. I often tell my clients to think of a physiotherapist like a dentist, except we treat the whole body, mind and brain. So for optimal living, you should schedule regular monthly checkups to ensure you maintain good health, and when there is an acute or chronic problem that needs treatment, you should expect to see us regularly for a short period of time. Modern day physiotherapists and exercise physiologists will also offer one-on-one training services to make you look and feel great and be there to support you when life throws you challenges. And as we all know, life will continually throw us challenges. So the better prepared we are, the more we enjoy life and the happier we make the people around us during these challenging times. Now that you've received further education on physiotherapists and some of the myths surrounding us, I hope to have empowered you to make the right decision and see a physiotherapist at the onset of an acute injury, or to help you with a chronic injury, or to simply unleash better health and happiness so you enjoy the good life longer.